Today, we will talk on your body's violent reaction to the wrong blood. It's a sight we see in hospitals all the time. A simple bag of blood, a lifeline, promising to save a life. For patients who have lost blood in surgery or from an injury, or for those whose bodies just can't make enough of their own, a transfusion is a miracle of modern medicine. But what if that bag holds a secret? What if, inside this life-saving fluid, there's a fundamental error? A mismatch so profound it's about to turn the body against itself. Imagine your own immune system, the loyal army that's defended you from every cold and flu you've ever had, turning into a ruthless assassin. A single drop of the wrong type of blood is about to enter your body. In that instant, your ultimate defense system will become your most violent enemy. This is the story of a transfusion gone terribly wrong, and the cellular chaos that threatens to shut a body down completely. The Guardian Army. To really get the betrayal, you first have to understand the piece. Your bloodstream is a bustling, perfectly organized society. Red blood cells are the tireless couriers, delivering oxygen to every corner of your body. And your white blood cells, which make up the immune system, they're the guardians, the soldiers, the intelligence agents. They have one core mission: seek and destroy any foreign invader. To do their job, they need a way to tell us from them. Think of it like a uniform. Every single cell that belongs in your body wears a specific uniform, decorated with molecular markers called antigens. Your immune system has spent your entire life memorizing every last detail of this uniform. The most critical markers are the ones that decide your blood type, which are governed by the ABO and RH systems. If you have type A blood, your red cells wear the A antigen uniform. If you have type B, they wear the B uniform. If you're AB, they wear a funky combination of both. And if you're type O, your cells wear a plain uniform with neither A nor B antigens. Your immune system is cool with your own uniform. But it also comes pre-programmed with a deep-seated hatred for any uniform it doesn't recognize. A person with type A blood has anti-B antibodies floating around in their plasma, like soldiers with shoot-on-sight orders for any cell in a B uniform. This is the normal state of affairs, a loyal army protecting a nation of loyal cells. But this peaceful kingdom is about to be invaded by a Trojan horse. The inciting incident. Before we continue, please subscribe and press the notification bell. The transfusion begins. A bag of donor blood, let's say type B, is hooked up to the IV line of our patient with type A blood. To the naked eye, all blood looks the same. But on a microscopic level, a foreign army is pouring across the border. Billions of red blood cells, each wearing the enemy B antigen uniform, start mixing with the patient's own blood. For a moment, there's an eerie calm. The foreign cells start to circulate, ready to deliver oxygen, their intentions seemingly helpful. But they're marked. The patient's immune system, always on patrol, immediately sounds the alarm. The anti-B antibodies, which have been floating harmlessly in the patient's plasma their whole life, suddenly have a target. The invasion has been spotted. This recognition is instantaneous and catastrophic. The patient's antibodies are built for this exact moment, to find, bind to, and mark any cell carrying that B antigen for immediate destruction. This isn't a slow, considered response. It's an explosion of defensive fury, a declaration of all-out war inside the veins. The alarm is sounded. Within minutes of the transfusion starting, the first signs of trouble appear. A sudden feeling of dread or a strong sense that something is terribly wrong is often the first clue. This is quickly followed by a raging fever and intense, shaking chills. Their body is reacting as if it's been invaded by a deadly pathogen, because from a cellular point of view, it has. The patient might complain of a burning feeling along the vein where the blood is entering, or a deep, aching pain in their lower back. That back pain is a grim sign. It's the kidneys beginning to scream under the strain of what's about to happen. As antibodies swarm and latch onto the invading red blood cells, a process called agglutination begins. The foreign blood cells are no longer floating freely. They're being glued together into massive clumps. Imagine traffic on a superhighway suddenly hitting a dozen multi-car pileups. These clumps of red blood cells start to clog the body's tiniest blood vessels, the capillaries. This microscopic gridlock chokes off the blood supply to tissues and vital organs. The very purpose of the transfusion, to deliver oxygen, is now doing the exact opposite. Tissues are starting to suffocate. This is just the beginning of the cellular chaos, and the body's violent reaction is only getting started. The cellular chaos. Inside the blood vessels, the war is escalating. The antibodies stuck to the foreign red cells don't just clump them together. They trigger a devastating chain reaction known as the complement system. Think of it as calling in an airstrike. The complement system is a group of proteins that, once activated, literally punches holes into the membranes of the marked cells. This is called acute intravascular hemolysis, the mass destruction of red blood cells right inside the circulatory system. The invading cells rupture, spilling their contents everywhere. The most dangerous of these contents is hemoglobin, the protein that carries oxygen. While essential inside a red blood cell, free-floating hemoglobin is a powerful poison. The plasma, normally a pale yellow, starts to turn a shocking pink or red. The patient's urine may turn dark red or brown as the kidneys desperately try to filter out the toxic sludge, but they are completely overwhelmed. The sheer volume of hemoglobin starts to clog the kidney's delicate filtering units, leading directly to acute kidney damage and failure. At the same time, this massive inflammatory response triggers another disaster: disseminated intravascular coagulation, or DIC. The body's clotting system goes into overdrive, forming thousands of tiny clots all over the body, blocking even more blood flow. But this frantic clotting uses up all the available clotting factors. The cruel irony is that after this widespread clotting, the patient is left with no ability to form clots at all, putting them at risk of unstoppable bleeding. The body is now fighting a war on multiple fronts, and every defensive move is only making things worse. The hemolytic fury. This is the peak of the crisis, the full-blown acute hemolytic transfusion reaction. It is a life-threatening medical emergency. The patient's blood pressure plummets as their blood vessels dilate, a condition known as shock. Their heart rate skyrockets, trying to pump blood that's becoming less and less effective. Breathing becomes rapid and difficult. The cascade of organ failure accelerates. The kidneys, choked with hemoglobin, begin to shut down. The lungs struggle to oxygenate what's left of the functional blood. The liver is under immense stress. The brain is starved of oxygen. Without immediate and aggressive intervention, the outcome can be fatal. Death can occur from shock, kidney failure, or the circulatory collapse caused by DIC. This entire violent symphony of destruction, from the first drop of wrong blood to the brink of death, can unfold in under an hour. It's the immune system doing its job with terrifying efficiency, but against the wrong target. The guardian has become the executioner, and the kingdom it was sworn to protect is now in ruins. The aftermath and the science. If doctors recognize the reaction in time, their first and most critical action is to stop the transfusion immediately. The patient is then treated aggressively with IV fluids and medications to support their blood pressure and breathing, trying to keep the body functioning long enough for it to clear the toxins and for the immune storm to pass. So how is this nightmare scenario prevented? The answer is in the meticulous protocols of modern transfusion medicine. Before any transfusion, a process called typing and cross-matching is done. The patient's blood is tested to find their ABO and RH type. Then, a small sample of the patient's plasma is literally mixed with a sample of the donor's red blood cells in a lab. If any clumping or reaction happens, that unit of blood is rejected. It's a final, real-world test drive to ensure compatibility. These procedures are why a fatal reaction from this kind of mismatch is incredibly rare. Data from the U.S. Food and Drug Administration, covering 2010-2019, shows that the rate of reported fatalities from an ABO-incompatible transfusion has fallen to about 1 in every 7.14 million units transfused. When these errors do happen, they are almost always the result of human error, like mislabeling a blood sample or mixing up patients at the bedside. The complexity of our own biology is both awesome and humbling. The same system that saves a life can also, with the wrong instructions, unleash unimaginable violence. Understanding this delicate balance really drives home the importance of medical science and the procedures that keep us safe. If this journey into the cellular battlefield sparked your curiosity, consider subscribing for more stories from the frontiers of medicine. And maybe the next time you see a call for blood donations, you'll have a deeper appreciation for just how vital it is that the *right blood gets to the right person, turning total strangers into lifesavers. The story of a mismatched blood transfusion is a dramatic tale of